that, I yield the floor.
Majority side?
3 minutes.
And on the minority side?
55 minutes.
Well, I reserve the balance of the majority time.
Senator from Tennessee.
Mr. President, during the next 55 minutes, we'll have several Republican senators come to the floor, and I ask unanimous consent that during that time, Senator McCain be allowed to be the manager of a colloquy among the Republican senators. Thank you, Mr. President. And before Senator McCain begins, I'd like to, if I may, take a moment just to establish where we are today, what happened yesterday, and as a lead-in to what he's about to discuss. Yesterday, Senator McCain offered an amendment on the floor of the Senate that would do two things. It would send back to the Finance Committee the Democratic health care bill, which is the 2,000-page bill right here, and it would say to them, one, take out the cuts in Medicare, and two, any savings in Medicare must go to make Medicare more solvent. That was the McCain amendment. That was defeated. 58 Democrats said yes to the cuts in Medicare. They said no to using they said yes to using the money that comes from these cuts to create a new entitlement program. 40 Republicans said no, we don't want to do that, and 2 Democrats joined in that as well. So yesterday, we made it clear that the central core of this bill includes nearly $500 billion in cuts in Medicare. There's no question about that. Everyone concedes that. The President has said that when he addressed us. The Congressional Budget Office says that. The question is whether it's a good idea or a bad idea. And yesterday, by 58 votes, the Democrats said yes to these cuts to Medicare. Today, what we want to do is talk about one of those cuts, and to try to do it in a careful, accurate way so that 11 million seniors who have Medicare Advantage understand exactly what the risk is to their Medicare Advantage policies. You can see that under the cuts approved again yesterday in this bill are $120 billion over the next 10 years in cuts to Medicare Advantage. Now, what is Medicare Advantage? Medicare Advantage is an option that seniors have. Medicare, if you choose that option, pays a fixed amount for your care every year to companies that might come to you and offer a Medicare Advantage plan, which you can choose instead of the original Medicare plan. Many seniors choose these plans. 11 million seniors. Nearly 1 out of 4 seniors in America who's a part of Medicare chooses the Medicare Advantage plan. In my home state of Tennessee, the number is about 230,000 Tennesseans. Why do they choose it? Well, it includes some benefits that they may not have in the original Medicare plan. These are dental care, vision care, hearing coverage, reduced hospital deductibles. It includes lower co-payments, lower premiums, coordinated chronic care management, and physical fitness programs. Now, the distinguished senator from Oregon was on the floor. He mentioned Grandma. I've mentioned Grandma a few times. No disrespect to Grandpa. He's in the same boat, and he said that Grandma didn't need to worry about her Medicare Advantage plan because none of the benefits would be cut. But, Mr. President, that's not what the director of the Congressional Budget Office, who's often cited by the distinguished chairman of the Finance Committee, said. He said, the CBO director said that fully half of the benefits currently provided to seniors under Medicare Advantage would disappear under the Finance Committee plan, which is much like the plan we're considering. And these would include those I was mentioning. So today, Mr. President, with Senator McCain leading the discussion, we'd like to talk about the Medicare Advantage plan and why it's such a central part of this bill, because basically this is a $2.5 trillion bill. That's what it would cost over 10 years, and about half of it's paid for by these Medicare cuts, and the ones we're talking about today are the Medicare Advantage plan. So, Senator McCain, I understand that there'll be an amendment by Senator Hatch, who is already joined us, and I'm sure will talk about his own amendment. And he of course, was present on the Finance Committee, a leading member when Medicare Advantage was created, that there'll be an amendment today to send back to the Finance Committee and say, don't cut Medicare Advantage.
And those that missed Senator Hatch's very important statement last night, which he will add to today, I would point out he was able to take us on a little trip down memory lane. In fact, during June 2003, when the Medicare Modernization Act was before the Senate, several of our colleagues, including Senators Schumer and Kerry, offered a bipartisan amendment on the floor to provide additional funding for benefits under the Medicare Advantage program. But amnesia is not confined to one side of the aisle around here. But I would like to ask my friend from Tennessee exactly, you know, this discussion about Medicare Advantage, we have to better understand what is this program and why is it so popular? Is it because it offers seniors a chance to get additional benefits? Maybe you could just give me a short definition of that, because I think the American people may not be totally clear of what we're discussing here and why 11 million Americans, 300,000 citizens in my own state have chosen Medicare Advantage, and has prompted, according to Bloomberg, Senator Casey of Pennsylvania to say, quote, "We're not going to be able to say, if you like what you have, you can keep it," said Senator Bob Casey, a Pennsylvania Democrat. And that basic commitment that a lot of us around here have made will be called into question. The title is, Dem Senator Says Medicare Advantage Cuts Break President's Pledge. So maybe if the senator from Tennessee would just give me a brief outline of what seniors get under Medicare Advantage and why it is so popular with 330,000 senior citizens in my state and 11 million all over the country.
Senator from Arizona, and I can do that, and he's exactly correct. And if the senator from Pennsylvania, Senator Casey, said that, he's merely repeating what the director of the Congressional Budget Office, when he said that fully half the benefits of Medicare Advantage would be lost. But in answer to your question, the Medicare Advantage is an option that 11 million of the 40 million seniors who are on Medicare have chosen. And the reason they choose it is because the plans that are offered by private companies, often to people in rural areas, often to minorities, often they have higher percentage. Lower income Americans choose these. They often choose them because the plans generally offer these benefits: dental care, vision care, hearing coverage, reduced hospital deductibles, lower co-payments, lower premiums, coordinated chronic care management, and physical fitness programs. So those are some of the benefits that these plans generally offer seniors.
Well, I thank my friend. And the reason why I ask is you mentioned that Medicare Advantage allows seniors to have dental care, vision care, hearing care, physical fitness. You know, fascinating. This allows our senior citizens to have dental, vision, hearing care, physical fitness. You know, that's a little strange because, as was pointed out to me, that's exactly what we have here in the United States Senate. About 100 paces from here, if I need some doctor's care immediately, if I need some vision care, if I need some dental care, next to my office in the Russell Senate office building for the last several months, and I don't know at what cost, I'd like to get entered in the record how many tens of millions of dollars it is. Guess what they're doing? They're renovating the gym. So my colleagues yesterday voted against keeping the Medicare Advantage program when we've got right here the best Medicare Advantage program that I've ever heard of in the world. Free hearing, free vision, free dental, free and expanding a gymnasium in a many months long project. And I will get the cost, although that may be hard to do. So let me get this straight.